Okay, so Connie has given me the ability to visit with everybody on the same platform that we do Commissioners Court. So we're going to get set up, and then I'm going to make a statement, and I was hoping that I could take some questions, and so I'm not sure that that is available, but you could always perhaps text. Or is there a way to raise your hand here, Connie, like in public comment or not? So if you join the Zoom meeting on our website, and then you could raise your hand, then we could actually bring you into the room here with us. So just kind of giving everybody just a chance to join that Zoom meeting. We'll just give it one more minute. Okay. Better, right? Okay. Okay, so we've got a test 1, 2. Bill, since you're in the room, we'll give you you'll get to give me the 3, 2, 1. Whenever you're ready, I'll be ready. Okay, so let me set the table here for everybody. First, obviously, we did not have a normal Tuesday press briefing, and this is not in lieu of that briefing. I'm certain that we'll reschedule that briefing, but because City Council is still conducting their business, they had to cancel. And because of the governor's announcements today, I felt it very important to be able to come and make a statement. So we are here in Commissioner's Courtroom at Nueces County Courthouse, and I'm Barbara Canales, Nueces County Judge, and I want to reflect made by Governor Abbott earlier in Lubbock today. Also, I'd like to be informative. For those of you that have not heard the governor's announcement, I want to try to summarize for you what we believe were the highlights of that message. And they are incredibly impactful, and they are a big departure from where we were today, this morning. And so let's begin by understanding a little bit more about that order, and then we'll talk about what this means for Nueces County. So put my glasses on here. Let me just say that today Governor Abbott did issue an executive order. This order rescinds most of the governor's earlier executive orders relating to COVID-19. And all of this will take place, the effective date will be next Wednesday. And as of next Wednesday, all businesses of any type may open to 100% capacity. Additionally, this order ends the statewide mask mandate in Texas. So in my capacity as county judge, I will be issuing orders which implement Governor Abbott's executive order. You might recall over the course of our COVID-19 response dating back to last year, anytime the governor had an order, Nueces County also made every attempt as quickly as possible to implement the orders here on a countywide basis. So because the governor has issued this order to become effective next Wednesday, on the same day, we will also make sure that our orders are rescinded so that they comply and comport with Governor Abbott's orders. And I know many of you will have many questions. Some of you are saying, why now? And others are probably on the other side of the fence saying, it's about time. And as county judge over this last, year plus of COVID-19 response, I will tell you that I am very keen to having both sides of the case presented to me and to this office and to this court. And so today the governor laid out his reasoning at the press conference and in his press release, as well as in the text of the executive order. And so I want to share with you, for those of you watching, what I took out of his comments. He talked about progress that we've made as a state. He talked specifically about PPE and medical treatments and practices like the ones that we emphasize every single time we take the mic: social distancing, wearing masks, and washing hands. He talked about the availability of effective vaccines, and he believed that all of those things in combination allowed us to be at the point where we could remove state-mandated rules. And I believe that orders definitely have structure, and his certainly did. And so he laid out facts, and he cited the laws, of course, which give authority for him to take such actions. And all those sentences start out with the word whereas. And that whereas is part of the order, and then that's the action part. And then afterwards it says, now therefore. And so as I was reading his order this afternoon, the first line was that Governor Abbott issued a disaster declaration certifying the novel coronavirus, which we know is COVID-19, poses an imminent threat of disaster for all counties in the state of Texas. And believe it or not, that declaration was made March 13th, 2020. And it's hard to believe, but that's almost an entire year ago. And so 1 year, and it has been a long year. It has been a tragic year. And this virus has made our loved ones and our neighbors sick. And it's taken so many lives here in Nueces County, but all across our nation. Over 500,000 lives have been lost due to COVID. Isn't that incredible? 500,000 people. And the virus required us to take action to protect ourselves and prevent the virus from spreading. And as you know, I'm recanting and restating, but I think it's important that we reflect. Students went online to go to school, and travel plans were canceled, and restaurants and bars locally and all across our state were closed or had capacity severely restricted. And if you'll remember, it's been a long time, but we actually were on a stay-at-home order for over 30 days. And the truth is, our normal lives became very not normal, and things were turned upside down. And these actions had their own consequences. And so I think that what I want to make sure that everybody understands coming from Nueces County today is that COVID has not gone away. It has not disappeared. It poses a threat to public health, and there are mitigation strategies to counter COVID-19. And sometimes they have costs as well. And some people, of course, stayed home because there was no job to go back to. Others stayed home because they had to be caretakers again, teachers again for their school-age children. And so many things happened, particularly senior citizens were in nursing homes were prohibited from visiting their families. And, well, you know, because we lived it together. And so we imposed restrictions here in Nueces County to mimic the governor's orders that we believed would help prevent the spread of the virus. And we modified them when the governor modified them. And when they appeared to be working, we saw those positive trends continue. And in fact, I just want to break here to say that I've seen positive trends here in Nueces County, and I want to get back to those positive trends, but you should know that right now we see hospitalizations decreasing, ICU hospitalizations decreasing, overall positivity of cases decreasing. And I want you to hold that thought, because we're here to talk about the facts, and those are part of our facts. And of course, I also want you to know that we are still actively and robustly testing here in Nueces County. And you know, this early detection that we've really been focused on has meant earlier monitoring and earlier treatment. With the opening of our COVID-19 clinic and our monoclonal antibody treatment, there is no doubt that we have been proactive on offense all the time here in Nueces County. And I'm proud to say that some of the, life-saving therapies and treatments, particularly those medications to lessen the severity of the illness, to help the body's immune system fight this disease, are here in Nueces County, available at our healthcare providers. And my goodness, did we not wait the arrival of that vaccine? And now we have a third coming our way, the Johnson & Johnson vaccine. And as a matter of fact, I received this news while I was at a vaccination site that Nueces County is conducting for educators, for teachers, along with Krista Spahn. And so we are actively, robustly working to vaccinate as many residents as we can, not just here in Nueces County, but in the region. And so as the governor has stated, Texas is administering 1 million shots each week. And by next Wednesday, he said that 7 million shots will be administered in Texas, and over half of the seniors in Texas will have received at least one vaccine. And the promise is that March, every senior who wants a vaccine should be able to get one. The vaccine supply continues to increase so rapidly, more and more Texans will be eligible to receive a vaccine. And boy, do I hope that that's true. In fact, we know our community has not received yet our full request. Our request was 25,000 a week from City County Health, and the most we've ever gotten was 10,000, and that was due to a catch-up week, which is the week of the winter storm. 5,000 from that week, first doses, and 5,000 from the week that we received. So we are far away from our capacity. And I'm super, always proud to say that Nueces County and our City County Public Health Department, they've been in the front lines this entire time for this fight. And it started in drive-through testing, building treatment capacity, and then starting mass vaccination clinics, and indeed being one of the leaders in South Texas with our regional vaccine hub. And we've come to this day in anticipation that we knew it would come sometime. We knew these orders would not stay forever. And for some, people believe that all our efforts have been very successful. And there was a great comment that was made earlier to me that there was, I guess, a TV personality who said that whenever it happens, whenever this moment comes when restrictions are lifted, it's going to feel for some people that it was just too early. And for those people that think it's too early, I just want to say I understand. I really do. And I want you to know the theme of my comments here are about keeping us safe. And in fact, my new motto for Nueces County is going to be still staying safe. I want us to find ways so we can still stay safe. And the important thing to remember, and this is very important, is that this governor's order does not diminish. It cannot take away common sense. It cannot take away common courtesy. And it cannot take away smart science. The provisions that the governor has given to county judges to impose restrictions if hospitalizations increase is very important. But make no mistake, I don't want to act as a county judge after the fact, after hospitalizations have gotten to a point where we would need to create restrictions. I want you to know that this governor's order, and we read it very carefully, it very much gives us the ability as responsible citizens and responsible businesses to limit capacity, to implement additional safety protocols at your discretion. And perhaps, maybe even more importantly than that, it states that in providing or obtaining services, here it comes, this is the good part, every person is strongly encouraged to use good faith efforts and available resources to follow the Texas Department of State Health Services health recommendations. Nothing in this executive order precludes businesses or any establishment from requiring employees or customers to follow additional hygiene measures, including the wearing of a face covering. In other words, we're going to be encouraging everybody here in Nueces County to keep doing what we're doing because it's working. You know how I know it's working? Because our hospitalizations are down, our positive cases are down, our ICUs are down. Finally, nurses and doctors are catching a breath for the first time in a long time. There's not been any normal for our healthcare providers at all. But we do see a good trend happening, and we need to maintain it. We need to keep it up. We need to definitely lock in those gains. And so we're going to encourage everyone, as I said, to keep doing what they know works, but there's not going to be a state order mandating it. And so I ask you to please do everything you can to keep you, your family, your neighbors, and your coworkers safe. We call this personal responsibility, but I'm also calling on it to just be a great resident of Nueces County. It's what it means when my mask says Nueces strong. You know what's right. for you and for your family. And you know exactly how to keep your family safe. I don't even have to tell you anymore because we've practiced it, we've lived it, we've learned it together. And together, we've taken Nueces County from the worst county statistic-wise in the country, and now we're at a place where we can be proud of. You know, I want to make sure that I'm calling on everybody to do what I think we normally expect of one another, and that's to be good neighbors. And please respect those businesses that choose to employ safety protocols in their place of business, whether it's requiring masks or limiting occupancy. You see, in order to still stay safe, we're going to have to be proactive. And what's right for me may not be right for you, and I understand that. And that's what the governor has said. He said Texas is now open at 100%. Texas no longer is going to require masks. And I think that what's going to be before our county and our commissioner's court is decide how we treat our own buildings, how the city treats their buildings, and we will have that discussion very quickly so that we can make sure that when this order ends, that we know exactly, just like any other place of business, what we think is going to be needed to keep everybody who enter into these premises safe. And we will make that decision together. And so I think that today's statement by the governor and lifting of the order is big news. It's very meaningful. And I have had the opportunity to speak with Krista Spahn. They're going to leave their protocols in place. I've had the opportunity to visit with our public health director, and she is going to encourage everybody to make certain that they're keeping up with the washing of the hands and all of the great hygiene practices. There is no reason to let up now. That's something that keeps us safe every day, with or without the coronavirus. It keeps us safe from all viruses. And then, of course, there's the opportunity when you cannot social distance, why not wear a mask? We know it's keeping Nueces County safe, and we think that you can continue this practice and continue all our good efforts. When will it really be over? Well, probably when we get herd immunity. And we don't have herd immunity in Nueces County yet. And we don't have herd immunity in the state of Texas yet. So we have work to do. It's just shifting the burden. Are you ready? Because I know I am. I know that whatever it is we mandate, it isn't as strong as what you mandate for yourself, for your business, and for your family. So let's join hands together, and let's still stay safe in Nueces County. Thank you. Okay, not a traditional press conference, but we will see if there is a way that we could take questions, and I might just have to have everybody field them through our PIO, Robert Durand, and Maggie Turner.
Judge, at this time we have no questions on the YouTube comments, and we have no questions on.
Great. Okay. So, any questions from?
Sure. Bill Churchwell with KIII. What was your initial reaction to the governor's announcement, and do you feel this announcement comes at the right time for us in Nueces County?
So, I was actually at the Toast of Texas when I heard about it. It is Texas Independence Day, everyone, and so happy Independence Day to Texas. And I was shocked, really. I knew that we were going to have some restrictions lifted. That was definitely, we felt that was coming, and I was expecting it to be for businesses. I did not expect it to be for masks, but interesting foreshadowing. When I walked into a Toast of Texas at Centennial House, a very good friend who I respect, said to me, I can't wait for these to be gone. And I hope the governor does something about that, right? So that was pretty good foreshadowing. And then by the time the event is over, I, was informed. And we've been, looking and studying the orders ever since. Is it right for Nueces? I think that the best way to answer that is that what I know is good for Nueces is for people to continue practicing all of the good measures that we've already learned. And I think that's something that we can do, and I think it's something that we need to advocate. It's, I'm not a doctor, but I've been involved with this public health crisis for over a year now, and what I can tell you is that it's very painful. Personally, it's painful for the families that have lost so many loved ones here in our county. And if we can take simple measures, like wearing a mask to keep somebody safe, I think that that's a very fitting thing to do. The question is the governor did not believe that it should be mandated. I think that we're already in the habit, in the pattern and practice of doing what's good. And I say, keep it up. That's what's right for Barbara, right? And my family. And what I'm going to ask is to shift the burden to all of you. But leadership doesn't stop, right now. It starts, to be honest with you. And somebody said to me that we are at a crossroads right now because we're so close. Every day, people ask me all the time, why are you so focused on these hubs? And I say, because we can do thousands of people every day. And I think that what I'd like to see is if we're going to, not have a mask mandate, how about open it up? Let's go ahead and open up vaccines for all Texans, because I need to make certain that we can protect Nueces County residents, and I know that can happen by getting vaccinated. So I want you guys to take advantage of all opportunities in Nueces County to be vaccinated, and I think that by opening it up to everybody, that will help us tremendously. And the second thing is, what's right for Nueces County is to send more vaccines our way. And when we can have more vaccines, we can achieve herd immunity faster, and we can keep each other safe by continuing our good practices. That's what's right for Nueces County.
One more question.
Sure.
For you. Of course, we're preparing to welcome visitors for spring break.
Mm-hmm.
This coming weekend, next week, and following week. And St. Patrick's Day, two big events for our local
Right.
area where we could see thousands of visitors. Of course, there are colleges who have canceled this
Right.
time-honored tradition for college kids. But are there any additional, maybe COVID precautions that could be implemented? Curfews on the beach or anything like that?
So we don't have anything like that planned at all right now. What I'd like the opportunity to do, and I've visited with my executive team here today and emergency management coordinator, Melissa Munguia, is that starting tomorrow, we're going to put together what we think is our COVID-19 community creed. And I think that we ought to set forth great practices for our community to be encouraged, right? We're all looking for guidance. Every one of us looks for best practices. I know I do, and I want to be able to share what I think our local health authority recommends, what our healthcare providers, Driscoll, HCA, and Christus recommends, what our public health director, Annette Rodriguez, recommends, and put that together in a role, and use my role as a leader to say, this is our creed, this is what we believe is good for our community, and we want to share it. We don't want to impose it upon you, but we want to share it. And we want to ask you to emulate it. And I think that is something that would be very welcome for our spring break folks, for our businesses that are going to take care of spring break tourists, and for parents and kids, in college. If we want to keep the trend exactly where it's headed, which is down, we're going to have to be proactive. It's not going to happen because we wish it away. It's going to happen because we take action. And I think that we can do that here locally and keep us on the right track. Thanks, Bill. Robert, anything else?
We had one question about the current hospitalization rates. The governor's order stated that if the hospitalization rate in our trauma service area, there are 22 in Texas, if that was over 15% for 7 consecutive days, judges would have the opportunity to impose question was, what is our current hospitalization rate? Today, in the TSU that we are in, it's 10.28%.
Okay, so I'm just going to repeat that. So it's at 10%. Now, I just want to give you a little flavor here. Probably less than a month ago, we were hovering, around 14%. We have just now, over the last 4 weeks, really seen a decline. Now, you might say, man, that's fantastic. But for someone like me, it's just been 30 days since we were still teetering on a place I didn't like at all for us to be. So it's very easy to go the other way. And that's what is important to remember. I also want you to know that Texas has seen all the variants. So we have the Brazilian variant, the South African variant, and the UK variant. And I will say that the variant is a game changer when it comes to the contagiousness of this virus. And so whether we're on spring break or at an event for St. Patrick's or with our family, be smart. Remember what I said earlier. The governor's orders does not diminish common sense. It does not take away that which we know works. It certainly gives a shift of the burden from saying it's mandated to you ought to know better. But I think that we can still stay safe if we just keep practicing those good principles. And the truth is that people that believe in it are going to continue to do it. And those that never did won't. And so let's stay together, because I believe the overwhelming majority of Nueces County residents have changed their behavior, have completely adapted to taking personal responsibility and conducting themselves and their businesses in a way that has kept us all, quite frankly, as I said, from worst and now almost to first. And so I think that we have a cause to be a watchful waiter, I think is what Dr. Blow from Krista Spahn always says. We're going to be watchfully waiting, but we need to recognize what's out there. And just like any type of inherent danger, don't you want to protect yourself? The variant is an inherent danger. It is a threat to our safety and security. It's a threat to this hospitalization, percentage rate, this capacity rate that we're studying every day. And I want you to look and use your community risk dashboard on nuecesknows.com. Every day you can find out what your community looks like by visiting our website, nuecesknows.com, and seeing what our profile is. Also, you can see how many people we vaccinated. And I will tell you, I'm very pleased on the rate and ratio of our vaccinations. But it's not enough to achieve herd immunity yet. So I will be going to Austin for an important policy committee meeting. And while I'm there, I will do everything in my power to make sure that our message is always strong and clear. We're ready, we're prepared, and we have a proven track record to do double the amount of vaccinations that we are currently doing today. Please send them, we'll tell Austin, because we know that we can help Texas in its quest to vaccinate all seniors who want to get a vaccine by the end of March. We want to continue to advocate for our homebound SOS program. Why? Because it's a model for the state, and it's important to make sure the most vulnerable amongst us are vaccinated. But we need vaccines to do that. So I think that our hospitalization rate is fine for right now at 10% in our region. But I'm grateful to the governor for giving us the opportunity as county judges, if we think it's going the wrong way, to make sure that we can have the ability to impose restrictions to keep our community safe. Thank you. Thanks, Bill. Thanks, Robert. Thanks, Bill. And everybody's watching. I appreciate it. And we will definitely see you back with more comments, most likely tomorrow.